In this video, we talk to Duncan Bannatyne OBE, who'll give his opinion on why health clubs and gyms should open, even if the lockdown ends on December the 2nd and tiered restrictions come in. Also, Huw Edwards of ukactive, who'll give us some data which backs up the arguments. This video will be shared with MPs. This is especially important as the petition calling for gyms to reopen has hit 600,000 signatures, easily meeting the threshold to debate it in Parliament, which will happen soon. We start with a short video featuring members at Duncan's health clubs in Wales, recorded just after the Welsh lockdown ended and they could go back to their exercise routines.
I'm really pleased the club is back open again. We're just straight back from lockdown now.
We lost a bit of fitness, tried to do, well, we got a dog now, so we did a lot of dog walking and the odd trip on the bike.
I really struggled during lockdown as far as training is concerned.
Really happy the gym's back open. For my mental health as well, with what's a big issue at the minute.
Yeah, great to be back. Great to see all the guys. Great to be lifting heavier weights.
The feeling it gives you after work when you come here to relax, unwind, recharge, train, see people, just the general social side of things.
Duncan, Huw, welcome. Duncan, let's start with you. We saw some of your members there from Wales. What are your members saying to you in other parts of the country where your gyms have been closed because of the lockdown?
Well, many members have contacted me and thanking me for making them feel safe and making the environment safe for them. And that's exactly what we've done. The fact that everyone has to wear a mask when they went into the club, to take the temperature, the staff are protected, and we have oodles of stations for them to go and wash their hands and disinfect their hands. And everyone should disinfect the machine after they use it and before they use it. Makes them feel safe and they're very, very happy. A lot of them have missed the gym. There are some people who don't need the gym. They can go and many people can't do that. We've got different aspects of the fitness, and that includes classes, gym equipment, and treadmills. I'm the same. I can't run outside. So they're very, very grateful.
Now, given that the gyms in England are locked down everywhere, regardless of level of COVID, is there a thought that because you've taken these measures, that the restrictions should allow gyms to open where they can?
Yeah, I think it's ridiculous that the whole of England is closed to gyms. They still have gyms open in Scotland. Well, 3 of my gyms have been closed, and I can understand that because they're in particular high areas. Wales is open, Northern Ireland's open, but England is closed a whole lot, just like as if someone couldn't be bothered just to look through the different areas and see what the level of COVID was and make decisions on it. So he's made a blanket ban on everything. It's crazy.
In the summer, when we had a lockdown in spring and summer, it potentially was easier for people to exercise. The weather was better.
Yes, there's ladies talking about that on Twitter now, showing pictures of the dark lanes where they're supposed to run. And they don't want to. They want to go to the gym and go on a treadmill. So that's happening now. And it's ridiculous that you should make people go out and run in dark country lanes. It's not acceptable.
Now, I know you're fully cognizant and agree with ukactive's position on things like obesity, mental health, and so on. Do you think that those arguments are things that the MPs should put first?
Obesity is a terrible thing, and if you get COVID and you're obese, there's less chance of you surviving. And so we are actually, by getting people fitter, getting them less obese, we are actually helping the problem. We're not the problem. We're assisting the problem. We're assisting people to survive longer.
Duncan, let's pause there. Bring in Huw Edwards from ukactive. We'll come back to you at the end. Huw, welcome. Let's put some data on screen. First, let's look at obesity. 18 million people are obese in England. That's according to the NHS. 3.3 million people have diabetes in England, according to Diabetes UK. Nearly 8% of critically ill patients with COVID-19 in intensive care units have been morbidly obese, compared with 2.9% of the general population. And then a killer quote. This is from Dame Sally Davies, the former chief medical officer. She said, "There is a direct correlation between obesity and high mortality for COVID." That was in the Sunday Times on the 15th of November. What do your professionals say about the ability of being a member of a health club to tackle obesity?
Thank you. Well, just echoing what Duncan said around the adverse impact that closing gyms and leisure centres have on your physical and mental well-being. I think we're all optimistic around the plans around bringing in a vaccine in the next sort of 4 to 6 months. However, that is not going to address the fundamental problems we have with public health in the UK. And the health inequalities we face as a nation are a fault line that runs straight through the communities in which our facilities are in. And these facilities are essential in terms of improving the physical, mental and social well-being of our customers. And so they're an essential service and they need to be open, especially when they've shown incredibly low prevalence to COVID within the facilities since they've been open.
Okay, well, let's talk about mental health, having looked at those pieces of data on obesity. This is your data from the Fitness Together campaign. It comes from Savanta, Comres and UK Active, and it says during the first national lockdown, 58% of people managed their mental health by being active. And as we just heard from Duncan, being active isn't as easy in winter, is it?
Absolutely, and it's been really important working with Comres on that, and like polling, it showed that the first time round, the restrictions that were in place, people saw the outlet of being able to exercise in the time they were allowed away out of their house was essential for their physical and mental well-being. And as Duncan has said, in November in the UK, those restrictions those options are much more restricted. And so the gym and the leisure centre would provide an essential outlet to support people's exercise activities during the winter months. And so that's why they're such an essential service to the communities across the whole UK.
63% of people say sport and physical activity helps reduce feelings of loneliness. And of course, a health club setting can help that as well.
100%. And, the recent polling, which is recent research just come out in the last 24 hours, has seen the major impact of COVID on issues of isolation across all ages, especially prevalent in people between the age of 16 and 29 as well. So not just perceived an issue for older people. And so it becomes a really important issue that, people see exercise as an outlet when these restrictions are there. And when we're going into the winter months, when the gyms and leisure centres are closed, that outlet is gone.
69% of people want to do more physical activity as a result of COVID-19. 51% of people rank exercise as among the top 3 ways to support the NHS.
Well, these are hugely important statistics because they show the importance of how people value exercise. There's accountability that people have to support the NHS. And we need to make our nation a lot more healthier and support the physical and mental well-being that people have to take pressure off the NHS, which is such a sacred institution for us all.
Let's look at the final slide, which is about transmission levels. There were 45 million visits to health clubs and gym settings since they reopened, and 0.99 cases of COVID-19 per 100,000 visits. Now, this is a very important slide because it addresses the arguments that are being put by scientists that gyms are a place of transmission.
Incredible amount of work has taken place, to make these facilities COVID secure. We co-developed the guidance which the operators and the members of UK Active utilise on across the country with the government, with the scientific advisors, with the chief medical officer's team, and they're probably the highest set of standards that any sector has to face. And then what you've seen is that operators have met that challenge, working with their customer base, working with their workforce to make sure that the cases of COVID within our facilities have been very low.
Duncan, 2 questions for you. The first is about the fairness of the economic recovery in your industry. If you were running a bar or a restaurant, and I know you do have a few restaurants, you could actually get some rebates, some support. But when you're running a health club, there don't appear to be the same levels of support, despite you being mandated to be closed.
Yeah, there's no support, apart from, of course, the normal furlough and relief on business rates. But other people, other industries have VAT reduced from 20% to 15%. There was a Eat Out to Help Out. I think you should do a Get Fit to Stay Alive and let us do even half price. The government should fund that. There's so much. There's so many in the industry struggling, and we will also struggle next year because we all have less members, and it's going to be harder to get more members because people have lost jobs, and so it's going to be difficult in this industry to survive even next year, even into 2022.
I know you're doing something about it. You're not just sitting there. We're doing these videos, but you're also writing to all the MPs in the constituencies where you have health clubs. You have many members, and we've heard that the issue is being debated in Parliament. What is your advice to your members and the general public about saying things to their MPs this coming weekend?
You should write to their MPs. You should say to their MPs, this is ridiculous and it needs to be sorted out. And an MP should take it very, very seriously at this time and take this debate very seriously.